So this patient's coming in for removal of a swelling on her right cheek. How long's that been there for you now, would you say?
A couple of years.
So it's got more symptoms than it looks like. It's coming to a bit of a head through here, and you can see where we've delineated the outside aspect of it. It's a little bit bigger than it looks. It's kind of these in-between sizes where you're stuck with, incisions will be a little bit different. How wide an area you take out will be a little bit different. What we worry about here, obviously, most importantly, is cosmetic results. I'm working with Dr. John again today. So those lines that dictate, better surgical healing, what are those lines called?
Langer lines?
Yeah, Langer's lines. And which way do they run in this particular plane?
More like oblique.
Yeah, so here at the eye, they come around almost exactly horizontal, and then they sort of fade off from that perspective. In the cheek, they come around like this. So mostly horizontal, so I'm just going to do more of a horizontal incision than a diagonal one, but I wouldn't do a vertical one. No pain here when I do that?
No.
So the challenge here is as we get a little bit wiser in years, our skin becomes more elastic, which is great from the standpoint if I did an actual elliptical incision, it'll heal nicer. But if I do a linear incision, try to dissect that down, it'll fight me a little bit. And that's what I'm going to start with, just to sort of see whether we can get that to come out sort of more intact with less irritation. So this will be fairly tedious work.
Is there caps on this as well?
This will be the issue. So if this is like an epidermal cyst, the answer is yes. If this is more of an inflamed sebaceous hyperplasia, then the answer may be no. So you can see the contours of the cyst there.
Mm-hmm.
So I switched back because that side seemed to dissect down a little bit better. I just want to extend it on this side a little bit.
Are you not using the Cryleys because you just want to?
No, I'm going to. I might use them in a second. But here, because I was talking before about the elastic nature of the tissues here, the Cryleys will sort of just dab that for me. Sort of just push tissue around as opposed to, like, I might use the scissors, just in a very fine fashion. So here with these Cryleys, so you can open that up. It doesn't dissect down tissue very well. Here, if I'm using the scissors, see, that might help me a little bit more.
Are you just going to hypodermis and then stopping?
Yeah, once I get down to the hypodermis, that's the second part of it, it's behind it. So that's what I'm looking for. There's the hypodermis. But she's a bigger subsection off to this side, which I want to make sure we're getting.
It's definitely a lot bigger than I thought down there.
Well, that's why I mark it with the marker. So that's full of the... Yeah, I just want you to appreciate it. You can see it there. There you go. That's the keratin there.
So you think that's epidermoid?
So now we just want to get thin suture material. So that's what I was saying. It's just tedious. Like it's the tissues are fighting you a little bit.
Mm-hmm.
Just like,
do you ever use anything finer than 6-0?
No, that's what I have up through here. I find here it's pretty decent. She's... Yeah, just keep her safe. We'll just clip this in. Short. Just give her a second. You okay? Yeah, give her
You're
a
okay. You're okay. You're okay. You're okay.
You're okay. You're okay. You're okay. You're okay.
You okay there? Still feeling okay? Yeah, we're gonna get you some water, some juice shortly.
Scared me.
Yeah, it's scary. Sometimes you'll feel like...
Did I think I bent my lip?
We'll check that in a second. Have you ever had a procedure before?
Uh-huh.
Probably not on your face, though.
No. Is it from blood loss?
No. It's just because sometimes the idea of somebody doing something this close is... It triggers a reaction that's...
It was scaring me.
Yeah. And I'm right above your face, too, so that's daunting. So with these ones, I just want to be... I'm putting just enough tension to close it, but not tightening it at all. I'm essentially just laying them together. So the tendency can be to pull them tight. And you don't want to put any tension across this. There's an argument even to be had that...
Oh, because you don't want puckering?
No, you don't want puckering. You just want the basement membranes to lie beside each other. And this is part of the same reason why we take them out so much quicker. There's an argument to be had, like, would you get away with just steri stripping?
Oh, right.
And I find as long as you take them out quick enough, just that way for me, you should be okay one way or the other. It's when you leave them in too long that people have those scars from the actual stitches. Very good. So you did well, so she's going to clean that up for you.
That must have made it harder when I did that.
Yeah, it's okay. What's life without some challenges?
Did you know what was happening?
I did. Yeah. At least as long as one of us knows. You'll get good.
Something happened to my lip.
Let's take it back.
Maybe you bite your...
Yeah, you might have a little bit, but nothing worse
Yeah.
than